Hi guys, welcome back. So today's discussion will be on the bony anatomy of femur, and this is the femur bone. This is an important question for the MBBS students, and for the anatomy classes this bone will definitely be kept in your examination. So coming to the introduction, 3 points in introduction of the femur. First point is it is the thigh bone, as we all know. It is the thigh bone. Second, it is the strongest bone of the body. Out of all bones in the body, you need a lot of force to break this bone. So that is why it is called the strongest bone of the body. Third point, it is the longest bone of the body. Of all the bones in the body, the length of the bone is the maximum. So it is the longest bone of the body. So introduction 3 points. It is the thigh bone, it is the strongest, and it is the longest bone of the body. Next. Coming to the parts of the femur, like any long bone, the femur can be divided into 3 parts. One is the upper end of the femur. Second one is the middle part, otherwise called the shaft of the femur. Third one is the lower end of the femur. Okay. Now, side determination. There are 2 femurs, right? One on the right and one on the left. So you will be asked in the exam to pick up a femur and to identify the side. For side determination, you have to see 3 points. One in the upper end, one in the middle part, one in the lower end. Now this 3 is femur, same femur seen from different sides. This is anteroposterior view, or otherwise seeing the femur from the front. This is the sideways view of the femur, seeing the same femur from the side or the sagittal view, and this is seeing the femur from the back or the posterior aspect of the femur. Okay. Now for side determination, first 1 point in the upper end. Look at the head of the femur. The head of the femur should point upwards and medially. Medially is anything towards the midline of the body. This bone is the ilium or the pelvic bone, which will be in the middle. This femur with the head articulates this socket called acetabulum to form the hip joint. So head of the femur is upwards and medial into the socket forming the hip joint. So head should point upwards and medially. Next, coming to the shaft. So this is the shaft. From the front, the shaft looks like a straight bone, whereas when you see from the side, the shaft is a curved bone, as seen here, like a bow. Imagine myself as femur. This is my head of the femur, and from the front, my torso or the shaft looks straight. But when I turn to the side, we have our belly, which is facing forwards. So this anterior bowing has convexity and concavity. So the tip of the bow is the convexity and the opposite side is called as the concavity. So the femur should be held in such a way that convexity should face in the front, like my belly is facing in the front. Now coming to the lower end. As we see in the lower end, these are the condyles of the femur. The condyles of the femur are flat in the front, whereas it is projected posteriorly, like our gluteal regions, which is projected posteriorly. So side determination, the femur should be held with the head facing upwards and medially. The bow of the femur or the convexity should be placed forwards or anteriorly, and this projected portion of the condyle should face in the back. So the femur which I am holding now is my right femur. Okay, so this is for side determination. Now coming to the individual anatomical parts of the upper end of femur. So now concentrate on the upper end, this part. So femur from the front, side, and from the back. This rounded structure is the head of the femur. This structure here is the neck of the femur. This structure here is the greater trochanter, and this projected structure here is the lesser trochanter. So rounded head of the femur, greater trochanter, lesser trochanter, and neck of the femur. And the line connecting the greater and the lesser trochanter is the intertrochanteric line. Okay, so greater trochanter, lesser trochanter, the line connecting it is called as the intertrochanteric line in the front. Similarly, the intertrochanteric connection in the back is called intertrochanteric crest. this portion. Why it is called line in the front and crest in the back? Because in the front the connection is smooth, whereas in the back the connection is elevated like a mountain, as you see here. So that is why it is called crest, intertrochanteric crest. And you see a small depression in the head of the femur, as you see here. This depression is called fovea capitis. Fovea capitis. This is the place where ligamentum teres gets attached from the acetabulum into the head of the femur. So these are the parts of upper end of femur: head, neck, greater trochanter, lesser trochanter, and this is the intertrochanteric crest in the back and intertrochanteric line in the front. Okay. Now coming to the shaft. Shaft is this middle portion here, this portion. So points in the shaft is cylindrical in structure. Why we call it cylindrical in structure? When we cut this femur here and look it from the top, like I break this femur and look from the top, this will look like a round. That is why it is called a cylindrical structure. Anterior surface is round like this, and posterior surface is slightly triangular. Okay, so the anterior surface is round and posterior surface is triangular, so that these two surfaces on the posterior part unite in the middle. This is called linea aspera. Now this is one surface, this is another surface, and this uniting line is called linea aspera. This gives attachment to the thigh muscles in the back. Fine. So this is for the shaft. It is cylindrical in structure with the bow anteriorly. Anterior surface is round, posterior surface is triangular, and these two triangular surfaces unite to form the linea aspera. Now coming to the lower end of the femur. The lower end of the femur, as we know, has two condyles. One is the medial condyle, another one is the lateral condyle. The medial condyle's highest point is called medial epicondyle, and the lateral condyle's highest point is called lateral epicondyle. Okay, and on the medial side, above the medial epicondyle, there is another one elevated point. This is called adductor tubercle, where the muscles which attacks the thigh gets attached. So this is the adductor tubercle. Okay, so this is the medial condyle, this is the lateral condyle. Lateral epicondyle is the highest part, medial epicondyle is the highest part, and there is an adductor tubercle here. And this flat anterior surface here in this portion of the lower end is called the patellar articular surface, because the patellar bone articulates with the femur at this level. So this is the patellar articulating surface of the femur. Now coming to the posterior aspect, when you see from the back, there are two condyles and there is a depression in between. So this depression is called intercondylar fossa. Okay, to recap: medial condyle, medial epicondyle, adductor tubercle; lateral condyle, lateral epicondyle, and this is the intercondylar fossa. Fine. Now ossification. How does a femur ossify, or how does it form? Femur ossifies from 5 centers. What are those 5 centers? Number 1 is the center for the shaft of femur. Number 2 is for the head of femur. Number 3 is for the greater trochanter. Number 4 is for the lesser trochanter, and number 5 is for the lower end of the femur. Of these 5 centers, number 1 is called primary ossification center, and all the remaining are called secondary ossification centers. So it is enough if you remember these points: 1 primary ossification center for the shaft, and 4 ossification centers, out of which 3 are for the upper end and 1 for the lower end. Along with this, you have to remember 2 numbers. The primary ossification center arises in the 7th week of intrauterine life, 7th week when the child is inside. So this is around 1.5 months. Whereas the lower end ossification center ossifies from the 9th month of gestation. So this is at the beginning of life, and this is almost at the far end of the intrauterine life. Okay. Now applied anatomy. What are the importance of what we have discussed now? One applied anatomy for each part. So for the head of the femur, head has a very peculiar blood supply. That is why many causes can affect the blood supply to the head of the femur, causing the head of the femur to go into avascular necrosis. So AVN, avascular necrosis of the head of the femur is very, very common. This is for the head. Now next, coming for the neck. What is the applied anatomy for the neck of the femur? The neck of the femur is intracapsular. What do you mean by that? Any joint is covered by capsule. Normally in other joints the capsule ends at the level of the cartilage, but in hip joint the capsule covers the neck also along with the acetabulum. So neck of the femur is intracapsular, within the capsule of the joint, and this is the commonest place which fractures in old age, more than 60 to 65 years. Okay, this is for the neck of the femur. Now coming to the lower end, what is the anatomy or applied anatomy for the lower end? As I told you, lower end of the femur ossifies at the 9th month of life. So whenever, this is important in forensic medicine, so whenever a child is found dead and X-ray shows the lower end being ossified, which means the child was capable of existence as it has completed 9 months of life in which it is capable of independent existence. So this is important in medico-legal purpose. Okay. Now as a recap, upper end, shaft, lower end, head of the femur, greater trochanter, lesser trochanter, connected by intertrochanteric line in the front and intertrochanteric crest in the back, shaft with the bowing anteriorly, and lower end with the intercondyle or fossa and prominent condyles facing posteriorly. This is about the bony anatomy of femur. My next discussion will be on the femoral head blood supply, and this will be both for MBBS and for MS Ortho PGs. So if you guys need any topics or any discussions in particular, please mention it in the comment box so that I will plan my things accordingly. Till I meet you in my next discussion, bye.